Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
Joining us on the podcast this week, Danka Kucharczyk.
Danka is a hygienist working in general practice who has undertaken a fellowship in laser dentistry and has actually just completed her Biological Dental Hygiene Certification. And ever since Julia and I first started talking about having Danka as a guest, we were really excited to hear about the laser component of your practice and how you became interested in that.
It's a very exciting topic, and I think hygienists should really look into it. There are many out there who are already starting and trying, but I probably am one of the few in the country that have been doing this for so long.
And to be honest, this is an area that neither of us have a huge amount of knowledge in, and we're really looking forward to getting an education on how you use lasers in your everyday practice.
And I'm sure the listeners will be too, because actually really, like Josh says, something that we have a limited knowledge on, so looking forward to hearing all about that.
With your hosts, Josh Hudson and Julia Bruin.
So before we perhaps dive into that element of things, I'm going to ask you perhaps how, taking you right back to the start, what led you to apply to become a dental hygienist?
Well, so funny story. I went to a dental practice for an interview to be a receptionist. Basically, when I came to this country, it was when we just joined EU in 2004. And I qualified as a teacher, Russian and English languages teacher back home, and I didn't want to do it. And obviously I had to do something. So I went for an interview.
Why didn't you want to do that out of interest?
Probably because I didn't like teaching children.
Okay, fair enough.
Yeah, a bit difficult to do that job without doing it.
It is. I've done it for 1 year, and it's very challenging, yes. So no, I never wanted to be a teacher. I just wanted to learn languages. And so I went for an interview, and my dentist, the boss at the practice, said, well, it looks like you're quite academic. Maybe you want to be a dental nurse, but you have to go on a course. I'm like, fine. Whatever pays the bills, basically, right?
Yeah.
So I started that, went on a course a few months later, because I started in about February. So I started in September doing dental nursing for National Board certificate. And very often I worked with a hygienist, a male hygienist, who I at that time thought that most of the dental hygienists are actually male, because we back in Poland didn't have hygienists that I could refer to, as a profession.
Yeah.
And so I worked with him quite a lot, because the principal that I worked with, he wasn't working on Fridays. And so looking at what he's doing, I thought, well, that seems easy. I can do this. So I went and applied to the Eastman, because I've heard that this is the best school. Why not? I didn't apply to any other school, and everybody was surprised. I remember even Miss Watts at that time on the interview asked me if I did, and I was like, no. Someone told me that I should apply to Eastman, and I did. And I got her first time, which was great. Yeah. And obviously, Julia knows the rest of it.
Yeah. Well, that's nice to hear how the journey starts.
So you got into study here. You obviously studied, graduated. And can you tell us a little bit about that first few years after graduation? How did you find that, going out into the kind of big wide world, so to speak, as a qualified hygienist?
Well, I probably, like everybody else, thought that it was hard at the beginning to change from this environment where you had an hour and a half of time to see a patient, and someone will let you know if it's not completely right, to half-an-hour appointments every half an hour. Yeah. I was very lucky because at the practice that I worked before I got into dental hygiene later on, then I worked with another dentist who bought a practice just before I went into Eastman. And when I qualified, he straight away gave me a job.
That's good.
And he was very understanding, even though he was paying me for 45-minute appointment, the patients were paying for half an hour, just so I got into the whole routine and had time and didn't have to stress and had breaks between. So we are very good friends since I got into dentistry, basically. So
that's good.
So it's a good investment of
it
time,
was
if
very
you like,
good
if you like,
investment.
because
Yes.
then you can start feeling comfortable about seeing patients, and then
after 1 week, he was asking me if I can do another day.
yeah.
And yeah.
So if you were going to describe that early period, those first few years in 3 words, what 3 words would you use?
Lucky. With all the people that I've met along the way, and principals and all the staff. I was fairly lucky with the nurses, were very understanding. 7 of them through all my practice that I've been working in a few different practices went into doing dental hygiene.
So you've inspired people then.
Yeah, already, yes. And second word will be naive, I think. Thinking that you can heal everybody on the first appointment. Basically, that's what I wanted to do. I was awesome at what I was doing, and realized that I was naive as well, thinking that people want this. They don't want to put that much effort all the time, even if you wanted to do it. So over time, I obviously learned what to do and how to do it. There's both ways, the result. And I was curious as well about things out there. I read quite a bit still, even though I finished uni. And I saw that there is this vast technology out there already happening, maybe not as much in UK at that time, but it was. And then obviously I was again lucky enough to get to the practice that I started with the whole laser journey.
Okay, so let's perhaps tease that out a little bit more again, sort of perhaps going back to the beginning, if you like.
Yeah.
So you used the word curious, and so I'm going to say to you, what made you curious about lasers? I mean, what was your initial thought? What made you decide to perhaps go down that path?
So that was again quite a coincidence that I ended up in practice that started using lasers in London, and probably one of very, very few at that time, 12 years ago. I went for an interview to get a job like anybody else, and in the advertisement it was about working with a microscope, with a laser, and we will give you the training. I was like, yeah, I would do this. So I went in, and it turned out that my dissertation that I wrote at the end of my dental hygiene school, which was on a genetic predisposition to periodontal disease, it really helped me on that interview.
It sounds like that topic that you did for your dental hygiene end of training project there was certainly very interesting to the person that you ended up going to work for.
Yes, so he was impressed with my knowledge about the whole interleukin, cytokines, and the whole...
So you bamboozled him with bacteria, did you?
Yeah, of course I did. I had to show off a little bit. I did get the job, and I was the first hygienist there, sent to Florence in Italy for a week course at Excellent Dental Network, run by Dr. Matelli, who's got a few practices in Italy, and as well, as far as I know now, he's got a practice as well in UK, or he's invested in, or he's a partial owner, I don't know, a little bit more up north, as far as I know. So we at that time, the practice that I worked for were in some kind of understanding between them that we were using their protocol, and obviously they were training us, and then the further education was still with them if we wanted to. So I went there. Obviously it was great, it was sunny, I was paid to do this, and everybody paid for my course, and also I enjoyed it immensely. I learned how to use lasers and microscope, which was quite challenging at the beginning to get used to it, because obviously in the dental hygiene school you learn how to sit 11, 9 or whatever the positions, and then you have to adjust completely different, because with a laser you don't really move patient, it's just the patient that moving ahead, but you're most of the time staying in the same focus, otherwise you'll be just focusing for half of an appointment just with that microscope. So I went there and then started working in the practice.
So for people like myself and Julia with limited knowledge about lasers, can you sum up, first of all, what lasers are in this context and how they work in your daily practice? It's a big question, I'm sure.
It is, because just put a laser and how it works, what it is very difficult in just a few sentences. So what I can say, we obviously laser is a device like any other machine that you're using in your practice. It's a device that produces laser light. They've been around for about 3 decades already in general dental practice, so it's nothing new. They are more portable, they are smaller, you can access them easier, you don't have to have just one particular surgery designated for it, which will make it a little bit difficult for different practitioners to use it at the same time. So they are producing laser light depending of the medium that it's inside them.
Okay.
So we've got a medium that it's a gas, we've got solid state lasers and semiconductors. A gas like a CO2 laser, this solid state will be, for example, neodymium YAG laser and erbium chromium YSGG laser. And semiconductors are diode lasers. I use both diode laser and erbium laser in my practice.
So how do you use those? What treatments can you use those for? I presume it's different laser types are for different things. Is that right?
So I use 2 different types of lasers, diode laser and erbium chromium YSGG laser. The diode laser, it's near infrared with a shorter wavelength, penetrates deeper into the tissue, and erbium, it actually is a longer wavelength which penetrates very shallow. The difference is between diodes is few millimeters, where the erbium is only 5 microns, so it's literally just surface of like 5 cells width, kind of thing. I use lasers for different, they've got different applications, obviously. The diode laser usually for laser bacterial reduction, for photobiomodulation, for dentinal hypersensitivity. You can use them even for whitening as well, and a treatment of outfall ulcers and herpetic lesions. As I mentioned, every laser is looking for a chromophore. In our tissues, we are looking at melanin and hemoglobin. We are looking at hydroxyapatite and water. And there is one a cytochrome C oxidase, which is a molecule that getting to produce more ATP in mitochondrium. So the laser bacterial reduction, how it works is that the bacteria during the disease process, especially in a periodontal disease, they are more pigmented, and because diode laser is looking for that hemoglobin, meaning color, the atoms and molecules are actually absorbed into the bacteria and kills them, eliminates them, reduces the amount, basically. Because obviously in a normal dental practice, you treat patients and remove deposits from a teeth, and if you've got right equipment as well, gums like EMS, that is getting quite spread around, to use on the gums, and you can't really remove the bacteria from the tissue itself unless you're using the antibiotics, obviously. And that's what the laser is basically for. The chromium, erbium chromium YSGG laser that I use is to remove subgingival calculus from the surface of a tooth. It's the acoustic property of water, oxygen breaking within a pocket. And causing that.
I think this is fascinating. I mean, we could really talk about this in a great bit of detail, because actually I'm learning when you're talking like this. So perhaps you can tell us, why should we all be using dental lasers in our general practice and treating patients?
Do you think we should? Should we all be using dental lasers?
Definitely.
Okay.
I really don't know why people don't use it as often as it should. And obviously, when I started first and went on a course to Italy, and a guy tells me that, you can regenerate tissue, and no, there's a long junction epithelium. I know this, I've learned this, right? So we were all looking. There was a lady, there was a group of us from Europe, and she was from Denmark, I think, and she's like, don't listen to him. No. So when I only started using it and applying the whole protocol that we had, I could not believe the results. Literally from 1 week to another. And obviously at the same time I was working in normal private/NHS practice as well, and I was doing exactly the same thing. Because you have to remember, a laser is a tool like any other one. You have, and it's not a miracle maker, okay?
Yes.
So if you do not know how to do the basics properly on a very good level, it's not gonna make much of a difference to you.
Interesting. And then from a practical point of view, I guess, so you said about it being a kind of a tool in your toolkit rather than necessarily the way of treating everything. So do you do like kind of routine, in inverted commas, periodontal treatment and then supplement that with lasers? And how does it kind of fit into the practice?
Diode laser I use more often just because obviously has got so many different applications, and even for laser bacterial reduction, when there is just a normal gingivitis kind of stage, there's bleeding, there are bacteria there. We know this. Just to reduce the amount, it makes a great difference, and even with a probing afterwards, you're not spreading it around as much. Yeah. The erbium laser is more obviously when I do more periodontal treatment, but I obviously can't imagine working without the tool now. It's always there next to me if I need it. I always I'm lucky enough to have quite a long appointments with my patients. So
that was going to be my question. I was just thinking you're describing this, and I still haven't quite got a grasp of how long does one laser a patient for? Do you know what I mean? I mean, it might sound a very simple question, but I would really appreciate having a little bit more information about that.
So, for example, with laser bacterial reduction, you're going about 15 seconds around one tooth.
Okay.
on one of the surfaces. So let's say 30 seconds altogether on both lingual and buccal, for example, right? With erbium laser removing calculus, you are trying to keep to about 2 minutes maximum, because obviously you have to remember that there is a thermal radiation building up with diode laser, erbium laser. You have to think about all the settings that you've got on it. But altogether, if I've got a periodontal treatment, I've got a first 1 hour doing just the basics, obviously, cleaning, and then another hour to go around with both type of lasers, because I will do laser bacterial reduction, I will do the calculus removal, and then I will do some photobiomodulation, which is very low, non-thermal radiation, which is non-ionizing. Obviously, we have to remember that. And that takes a little bit longer time to get effect, obviously.
So you've sold it very well, I think, in terms of potentially using these in our general practice. So if somebody's listening to this and they're thinking, okay, that's something that sounds quite interesting, I'd like to explore that a little bit more, where would you recommend they go? Was there resources out there? Is there courses? How would somebody get a little bit more information to maybe then pursue this route themselves?
Again, when I started, there was hardly anything in here. I've been to, obviously, paid course. Then I actually had to invest myself. I went to Canada for more advanced laser for dental hygienists. There was nothing in here, unfortunately. Everything was more towards what dentists could do. You could learn there. I went on one of them, and you can learn some things, but not much. And what the problem is in most of the courses is that dentists don't know what is the scope of practice of dental hygienists sometimes, even those who are doing the courses, and how much different for us is to work, right? In general, if you are having a nurse, you're lucky. And doing all those other things, it all takes time, right? So they don't know this, they don't know how, what hygienists are allowed to do with the laser sometimes. Now it's a bit better, and BioLase is one of the companies that supplies the lasers in UK. Now has got courses for dental hygienists and therapists. There are very good courses through World Clinical Laser Dentistry Institute, so it's all in Europe. And there is Academy of Laser Dentistry that I again just did another level with as well. That was very interesting, because they've got, obviously there's Dr. Dabbar, who is in UK and teaches through them. So there are resources out there. You just type laser periodontal treatment courses or laser courses for dental hygienists, and things come up. Rina Al-Falaki is one of the periodontists who works in London as well. She provides courses. They are on Instagram, perio _courses. So she does something for hygienists as well.
It's definitely growing out there.
Yeah, it definitely is. There is so much more comparing to what I had to work with at the time.
And you've just completed your Biological Dental Hygiene Certification.
Yes.
So perhaps talk us through that bit.
So it's a certification through International Academy of Oral Medicine and Toxicology in America, again, obviously. It was a 10-unit course that I had to complete online. Since COVID, obviously, it's much easier, because most of the time you had to travel somewhere for them to allowing you to finish something. Now you can do the hands-on kind of course online again. that was to get a little bit better understanding what my practice is really doing. I knew what they are doing, but obviously when you're a dental hygienist, you are in your own room with your nurse, if you're lucky. I am. You don't see what they are doing, so I knew that there is something about cavitations and
yes, because your practice, as you've described it, is a
biological.
So perhaps just clarify what that really means for our listeners.
So it's, well, when we were at dental hygiene school, we were all told, you have to treat a patient as a whole, not as a set of teeth. Mm-hmm. When you come out of a dental hygiene school, it's a little bit different story, even though you try to obviously remember this. Our approach is definitely to look at the patients as a whole. There is a lot of people out there who are having problems with their general health, and very often they don't find answers until they look a little bit further. They pay more money for private treatments and tests that cost as well money. And these are people who are very often suffering from autoimmune diseases and chronic diseases, fatigues, and in general, the life is a little bit more difficult for them, and they've got loads of hypersensitivities as well to metals even, or any chemicals used. So our approach is obviously to reduce that toxicity in a practice to the minimum. If there are very often the patients require to have the metals removed because they do influence their general health. As we know, we've got these things, areas that there is inflammation in our body. Even a periodontal disease or a gum disease will cause that. It's a low-grade chronic problem, but for someone who's got all the other things happening, it makes it causes a havoc sometimes, right? So they are trying to reduce that toxicity. So we are removing mercury fillings in a safe way, when the vapor during the removal is minimized. Patients are wearing special masks for it, and dentists as well. Obviously, everything is done with rubber dam and a very high suction and some other equipment involved. There was a part about, obviously, cavitations, which not many people actually know about. I think it becomes more and more available to read about, although it's nothing very new according to the course that I did. There's lots of studies done already.
So certainly this whole bringing the patient's body back into the mouth.
Yes,
I think we're hearing a lot more about that, aren't we? And
yes.
I think it sounds like your practice is
Exactly.
very focused on that.
That's it. We are trying to improve the immune system before they actually start having any treatment, even periodontal treatment. We do tests for vitamin D, C, all those levels to bring them up to have better results as well, even if they are having implants done. We do ceramic implants rather than titanium. And so all this is to kind of help them and reduce that inflammation in their body.
So we've talked about quite a few things there that maybe you're doing slightly differently to maybe a lot of other hygienists that are out there. If you were going to think of something that the whole dental industry should either start doing or stop doing, and I know you've already said we should all start using lasers, but is there anything else that you think that we should as an industry either start doing more of or stop doing as much?
Well, truly speaking, when I was reading all this about amalgam fillings, for example, I think that we are beyond now need of using amalgam fillings. I think it should be wider available to have composite fillings for patients. We know that mercury is a toxic, although obviously in dentistry still that it doesn't cause problems when it's in a mouth. There are studies obviously out there, and again, as I said, some people are just more sensitive. They don't even know that they are. That's the only issue. So I think that would be a good change if we could move to white ones. I remember that I had all mine removed, changed into composite when I was back home when I was about 16. So I would definitely vote for that. To be changed, and he looks nicer. Come on.
So what? My question's a little bit random, but I think it was always nice to include a little random one in these podcasts, isn't it? So you've got a billboard poster in Piccadilly Circus. Everybody can see it. Everybody who comes to London to Piccadilly Circus can see this billboard. What sort of dental message would you put on it?
The mouth is just the beginning to your health.
Yes, that's.
I think that will be it.
That's a beautiful message to have on there, and increasingly we're finding that, aren't we, with all of the research that's going on.
And I don't know if you've noticed, after the COVID, I had patients who haven't seen a dentist for 15, 20 years, okay? Awesome cases, right? We're looking forward to those cases for years. When you're in one practice, you see the same patients all the time. But what it definitely brought people attention was to start looking after themselves.
Yes,
you know, we as a profession, we can definitely improve this general health through eliminating those conditions that, as long as a patient is working with you, it definitely can be stopped.
So if you think back to the start, when we first started talking, we asked you the 3 words that described the kind of early stages of your career. And you've obviously come a long way since then, and there's been a huge number of doors that have opened, lots of different things that you've been able to pursue. If I asked you the same question now, of 3 words that you describe where you're at the moment, what 3 words would you use?
So we all are trying to obviously follow the evidence-based dentistry. With me, over years, I've noticed with lasers, you can't provide the same treatment to every patient. You have to provide different settings, and this is one of the problems to get this randomized studies on patients, is because you can't do that, and very often I think that's why known periodontists and dentists kind of put lasers aside. So you have to be open-minded that there's a lot of clinical studies, like, you know, on a daily basis, when you're seeing the results of what your work does, it counts as well, right? You have to be open-minded that what you've learned is the beginning of your journey, and you have to learn more to get better. And there are different things out there. You have to be obviously vigilant. The second word, I think it will be excited. With all the knowledge that I have now, and there's still so much to learn, I'm excited to do some more with the lasers and actually apply to do dental therapy at the University of Essex. Because as a dental hygienist, unfortunately, we can't do much. A shame is as well that we as a dental hygienist in UK can't do much more as for example, hygienists in the States or Canada. So that's something to really working on. I had a chance to do a cavity preparation on a course that the fellowship that I did with Eastman Dental and University of Genoa. To use erbium chromium SGG laser for a cavity preparation, and I'm like, oh my god, I'm so doing therapy. It was so cool to use laser to remove dental caries, right? So that's what excites me. Excites me as well that when I did the biological dental hygiene course, it just opened up those idea that laser is not the... Because when I started doing laser, it was all about me being a laser hygienist. I'm a London laser hygienist on Instagram as well. It was all about just the laser, but now I know that it's just one of the few things that you can use, the ozone and all those other things that I can incorporate. And I'm excited. I haven't been excited like that for a while. So that will be a third one. And I feel awesome in general. The third word will be being awesome. I do things for my patients that they are just so grateful for. They feel better. I remember a lady who said they had a treatment with me, and after using lasers, she could stop using her medications for diabetes.
Makes you feel really good.
It makes you feel really good. And every day when you hear how great you are, why not feel awesome, right?
That's great. I think that's a lovely way to end. Thank you so much for joining us.
Thank you
Thank
very,
you
very
so
much.
much for having me here. It was a stressful time, but
great having you on the podcast.
Thank you.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe and listen out for future episodes.